Whether you're a medical imaging student or a technologist, you'll be encountering patients that are on precautions. Some of the areas that you'll be in where this will occur will be in the emergency room, in the inpatient radiology department, and when you're on portables. For this video, we're going to talk about some of the most common precautions that our patients are on here. So the first couple are over here. You're going to see these signs. Either when you go up to the patient's floor, you're going to find these signs posted on the patient's door or window before you enter the room. The first one is Contact Precautions Plus, and the other one is just Contact Precautions. The only difference is that on Contact Precautions Plus, you're going to wash and dry your hands after you remove your gloves and your gown. So you want to make sure that you see these, what they are, before you go into the patient's room for a portable, or if the patient comes down to the department, you'll have to take the necessary precautions by putting on the proper PPE or personal protective equipment. So what you would have to do for the contact precautions, you're going to disinfect your hands with CalStat. This is the hospital hand cleaner that we use here. So you'll clean your hands, and you're going to put on your gown. And all of these little drawers are found outside of each room and in the department in several locations. So you're going to put one of these gowns on. Some people like to tie it here first. Just put a little knot, which makes it a little bit easier. Goes right over your head. Put your hands through it. And then you're going to take your gloves. And you put your gloves on. And once you're all covered up, you're ready to go, you'll go into the room, you'll take your x-ray. When you're finished and it's time to leave, you're going to do everything in the exact reverse. So we're going to start by taking your gloves off first. You want to fold them so they're inside out and dispose of those. Gown, you just come right over your head. And you're just going to roll it up like this. And you'll want to dispose of that in the soiled linen. And now that you've taken off the gloves and the gown, for the Contact Precautions Plus, you're going to wash and dry your hands with soap and water. So you want to give them a good wash. Some people actually sing Happy Birthday while they're washing their hands to know that they've done it thoroughly. And after you wash your hands with soap and water for the Contact Precautions Plus, and you dry them, you're going to go back and you're going to take another shot of the CalStat and then clean them up one more time. For the regular contact precautions, you're just going to do the gloves, the gowns, and the hand washing. So those are two of the most common ones that you'll see up on the floor. The Contact Precautions Plus are primarily for patients that have C. diff and norovirus, and the Contact Precautions is the common one for MRSA, MRSA, and VRE. The other precautions that we want to make a note of are going to be the droplet precautions and the bone marrow transplant precautions. So these are the signs that you're going to see on the patient's door. And for these here, you'll notice that you're going to just clean your hands with CalStat, put on a surgical mask, and put on gloves for the bone marrow transplant. And for the droplet precautions, it's just a mask and hand washing. So we'll just demonstrate that for you. So again, for the bone marrow transplant, we'll clean our hands with the CalStat. The surgical masks should also be on this cart. And you'll take one of these off, and these just go on. metal over your nose and the string, the elastic behind your head. Then you would put on a pair of gloves. And once these are on, then you're all set to enter the room where the patient is on bone marrow transplant precautions. You also want to make sure that the door closes behind you once you enter the patient's room so that the room stays in positive pressure. After you take the x-ray and you leave the patient's room, you're going to remove the mask first, and then you're going to take off your gloves. Again, try to put them inside out. And then once again, you're going to clean your hands with the CalStat. For the droplet precautions, you're just going to put on a mask and you're going to make sure that you wash your hands. One other sign that you're going to see up in the patient's room and when they come down into the department is the fall precautions. And again, you'll see this poster hanging up outside of the patient's room on the door or the window. If the patient is on fall precautions when they come down to the department, the way you're going to know about it is by checking the transport notice. It's the green sheet, the green sticker. It'll be on the front of the patient's chart, and you can see here under special precautions, and the nurse will have it checked off what precaution the patient is on. If they come into your department on fall precautions, you should not, under any circumstances, stand the patient up. Don't take them out of the stretcher. If you have to put them on the x-ray table, that's fine, but make sure you're assisting them at all times. If you go up to the floor and you're doing a portable on the patient, make sure that if you have to put the side rails down, when you're finished, that you put the side rails back up when the patient is on fall precautions. You should always put the side rail up, but particularly when the patient is on fall precautions. But this transport notice is something that you should always be checking when the patient comes into the department so that you're aware of what precautions that they're on. The other point that I'll mention is that the transport note will tell you that the patient is on contact precautions or bone marrow transplant, but it won't necessarily tell you why. You won't know what illness the patient has, just that they're on precautions.